Okay, today we are going to be inserting an NG tube into our patient. First, I have checked the doctor's orders in the MAR to make sure that we are placing the NG tube on the right patient. I've gathered also my supplies, and now we're gonna go talk to our patient. Open the door. Hi Jonah, my name's Brandon, I'll be your student nurse today. I'm just gonna shut the door and the curtain for some privacy. Today what we're gonna be doing is we're gonna be inserting an NG tube. So it's a tube that goes from your nose down into your stomach, and that's for that GI bleed you've got going on. Have you had one of these before? Yes, you have? Okay, so you kind of know what this is all about. Okay. So first we can just do some hand hygiene. And then I'm just gonna check your wristband. Can you just state your full name and date of birth for me? Perfect. Everything matches what I have here and on the orders. Are you allergic to anything? Do you have any allergies that you know of? No? Okay, sounds good. Hand hygiene one more time. And I'm gonna put on some gloves. Okay, Jonah, we're gonna get started with our procedure. And I'm gonna explain it as we go through. So if you have any questions, please just let me know. So I'm gonna raise the bed to a more comfortable working height. We're just going to sit you up to a 45 to 90 degree angle. Okay. Let's get our supplies out. I'm just going to do a drape here so we protect your clothes, okay? It's more comfortable. And then we have our emesis basin for any vomit. Our water cup with our straw that we'll need in a minute. And then, Jonah, I have some tissues for you because your eyes probably will water. It's normal with this procedure. Yeah. Just get everything else set up over here. Okay, Jonah, the first thing that I'm gonna do is I'm gonna just check your nostrils, okay? Can you breathe out of this side? And now this one. Okay, which one feels better? This one? Perfect. So whatever nostril is better to breathe out of, we're going to be inserting it on this side. And in this case, it's the patient's right side, so we will be inserting it on this side. Now the first thing that I'm going to do is I'm gonna take my clean, new tube, and I'm just gonna measure it. So we're gonna take it from the nostril over to the earlobe, and then we're gonna go all the way down to the xiphoid process, which is going to be right there. So now I'm just gonna take my marker, and I'm just going to put a mark right there where it needs to be. Okay. Now that I have that marked, okay, Jonah, I'm gonna have you kind of tilt your head back for me as much as possible. And we're going to lubricate the end of the tube, about 2 to 4 inches. Okay, Jonah, the first thing that this is gonna do is we're gonna go in through your nose, and it's gonna go to your pharynx. Then we'll stop, okay? You're gonna feel some pressure and a little bit of pain, but we're just gonna keep going, and you're gonna let me know if you feel like you can't breathe, and we'll stop, and we'll go from there, okay? So the first thing I'm gonna do is we're gonna tilt your head back. We're gonna go into the pharynx. Okay. So now that we are into the pharynx, I'm gonna have you tuck your chin as much as you can. You're gonna bring your chin down to your chest, okay, Jonah? And I'm gonna have you sip on this water. You're gonna keep sipping while I put this tube down, and you're gonna swallow the tube with the water, okay? Ready? Sip, sip, sip. Keep going. You're doing good. Keep taking sips. Okay. Now that we are to our marking, go to our marking. So now what I'm going to do is I'm just going to take my tape here and I'm just going to tape it to Jonah's cheek until we can confirm that we have accurately placed the NG tube. And during the procedure, if I notice that he couldn't breathe or we are getting some cyanosis, I would have stopped the procedure and pulled the tube out and we would have restarted at a later time. Jonah, can you talk to me okay? Can you hum? Yeah? Sounds like you're doing great. Okay, so now what I'm going to do is we're gonna confirm that the NG tube is in the correct place. So I'm gonna take a sample of the stomach contents. I'm just gonna pull it out through the tube here. I'm just gonna set that up here. Just pour it into this cup. And then I'm gonna take my dipstick here and it's gonna tell me the pH of the stomach contents. Okay, and we want it to be this orange color, and that'll tell us that we're in the right spot in the stomach, and it matches it, so we are good. And then the second way that we would confirm that we are in the right place is with an x-ray to see that the tube is actually into the stomach where it needs to be. And now that we have determined that we are in the correct place, I'm going to take off my gloves, perform hand hygiene, and put on a new pair because I just messed with all that stomach content. Okay, and now Jonah, the next thing that I'm going to do is we're going to secure this tube a little bit better to your nose now that we know we're in the right spot. So I'm going to take some tape about 4 inches, split it down the middle a little more than halfway. This is just going to go right here on the bridge of your nose, and I would apply a skin barrier to this first, but I do not have any today. So what we're going to do is we're just going to wrap this around the tube. We can actually get rid of this one now that we're putting on the more secure one. So we're just going to wrap this around the tube so it stays nice and secure to your nose. It doesn't go anywhere. Now what I'm going to have you do is I'm going to have you turn your head, and we're going to give a little bit of slack. I'm going to get another piece of tape. I'm just going to do some tape right about here, and we're just going to pin it to your gown so that if you do move, that it's not going to go anywhere. It's going to be stuck to you, and it's not going to come out when you move, because that's going to be very, very uncomfortable. We do not want this tube going anywhere. So we are going to secure it to your gown right there, and we've got plenty of slack for head movement. And now what I would do is I would hook it up to intermittent suction per the doctor order. So I would take this off right here at the vent, and I would take this, right there. I would take this piece right here, and I would go here, this is the vent. I would go clear to clear with the intermittent suctioning, and this is just gonna help pull out all the stomach contents. And this would sit above the shoulder level, and like I said, it is intermittent, so it's not going continuously, and it is per doctor's orders. So I would hook it up to my suction, I would check to make sure that my suction is working properly, and then I would connect my tube, and would make sure my patient's comfortable, and I'm just gonna start cleaning up here. Then I guess what I would do is I would do some oral hygiene. I'm gonna dip this in my water, and I get the lips here and the mouth. I get it moist, and I would apply like a chapstick or a lip balm every 2 to 4 hours, just to make sure that our mouth and our lips aren't drying out. It's just good oral hygiene while we're on this tube. And I'm just gonna clean up here. Okay, Jonah, do you have any questions for me? No? Okay. I'm just gonna get you a little more comfortable. Now that we're all hooked up to the suction, we're gonna lay you back a little bit, but not too much, because we want that suction to remain working, and for that to happen, you have to be sitting up at a better angle. And the next thing that I would do is I would give my patient the coli, his water. And Jonah, if you have any questions for me, please call. I'll be back to check on you in just a little bit to see how you're tolerating it. And I'm going to take my gloves off, perform hand hygiene, clean up my supplies, and then I'm gonna go document the procedure.